Đây là đó này ấy. Điều đó nên hay score nhóm mấy mẹ đấy. Nhóm quy trình này tất luôn. Này compare cam với cái Campuchia, đâu có môi từ được. Và sau khi nào thì bạn khơi video đi hỏi, chúng chưa thả. Nên đó như các bạn score là đối chiết, nên những người này khi bạn tương tệ, nên mình tranh nó phải là cả hai này. Chúng người nó cứ như chúng thay mùi, đã thôi nhận họ không hiểu biết là cả chung trọng chặt đồng phương lưu trí, cả hướng cũng mất thì dùng vào chỉ đã để và phân chia mình ai chia ba hơn những kinh tế người nhà sản bản bắt đầu mà đó bên đây cũng chưa thà và hai chia nhẹ chúng nhiên nhẹ chúng được hai chia đẹp Việt Nam không thành đây hơi bản sản luôn thế chứ này nhờ nên phải cho mình ai nên chúng được mình start chia có điều bản tiền đi rồi nếu như mất trong ngạt tuổiนี่แน่นี่คือช่วยนี่คือจิตน้ำมันซาแต่มวยก็ได้มันซาจูนไปนิบานvà sinh viên này mình sẽ tập mình chia công phê vẽ cao bao nhiêu tí nó không đến tới slap nó không đi apel sai để cho nên nó đi bật chích miếng phơi tí và
so tired. I'm so hungry. Let's go. Guys, did you feel the shake last night?
No.
What
shake are you talking
It
about?
was really, really strong. Sobrang lakas. Nakakatakot kaya.
Uy, Uy, kamusta? I mean, how are you guys? Did you feel the shake?
Yes, I did.
I did? No, it didn't. What happened? I don't know, I just... Around what time?
Maybe 9 in the evening.
But was there any, like, did anyone get hurt or die?
I don't know because walang news sa store.
Oh, okay.
I didn't even feel the air.
Oh wait, I heard somebody died last night. So it's because of that thing? Was it that the shock?
Explosion! Kaya pala.
I don't know. Well, let's find out.
Kuya, tulong! Di makahinga!
Tulong po!
Kuya!
Hi, how are you feeling today?
Sakit po dyan. Okay. I have you have fever, weakness, abdominal pain, and difficult to breathe, yeah? Okay, to identify the root cause of your illness, I'll be ordering some complete blood count. Somebody will extract blood from me, is that right?
bubonic plague wiped out a third of the human population in the 1300s. It's also known as the Black Death. Here's what you need to know if you're ever infected by it. The bubonic plague, or Black Death, is a disease transmitted to humans by fleas and rodents carrying the infection. It was responsible for about 25 million deaths in Europe during the 14th century, or 30 to 60% of the European population at the time. The most recent outbreak occurred in mid-19th century Asia, where it killed over 12.5 million people in India and China alone.
I would like to introduce a little gram-negative bacteria named Yersinia pestis, or Y. pestis for short. He has a low resistance to environmental factors such as sunlight, high temperatures, and desiccation. Also, common disinfectants such as Lysol and chlorine will kill him. It is thought that the Y. pestis originated in the grasslands of Asia and slowly swept west to Europe over the trade routes.
Be transferred from human to human through aerosols such as coughing, sneezing, or handling infected tissue, such as removal of the dead. One of the most common pathways for human infection with bubonic plague is through a vector such as the flea. The vector breaks the skin and the bacteria are able to enter the host. A lesion will typically form in the tissue that is at the initial site of infection. As the bacteria spread throughout the body, the host may develop septicemic or pneumonic plague.
Nursing responsibility number 1. Administer medication such as antibiotic, IV fluid, and oxygen as ordered as needed.
Nursing responsibilities number 2. If the patient is suffering from the pneumonic type of plague, we have to maintain a patent airway and adequate oxygenation. Nursing responsibilities number 3. If the patient is suffering from bubonic plague, we have to apply a warm, moist compresses to the wounds.
Nursing responsibilities for number 4. Use standard precaution. Nursing responsibilities for number 5. Provide adequate nutrition.
We have to provide meticulous skin care to the affected area to prevent further injury. Number 7. Institute seizure precaution. 8. Report suspected plague cases to local public health department.